And Evelyn, it kind of lends to the question of and again, at outsourcedpharma.com, we deal with business models and strategic models of operation all the time. And we talk a lot about virtual companies and how virtual can you be and all of that. But in this day and age, is a startup company, so to speak, biopharma, advanced therapy, probably cutting edge, are they able to not outsource? Is it like decades ago where a pharma company just did everything? They got started on new programs and just brought them through. Can a company nowadays do that in this area?
Well, I think it's very difficult now, particularly when you're working with smaller biotechs, where funding is key at the start. And then obviously a lot of time and investment goes into working with a CDMO or a partner to make sure that, the right technology is put in place to make your product, particularly for these more advanced therapeutic products. And it is definitely more difficult. However, I think as well, it's not impossible. Nothing's ever impossible. And, this goes back to my point at the start of the conversation where you need to look and see if, when you're a small biotech versus a larger one, is that still right for you? Like, what is the tipping point to bring things in-house? And back to kind of what Todd said, and I agree with him about some of the activities, from a knowledge management perspective, I think one of the key pieces I would look at with clients is at the start, particularly when I have, when I'm setting up organizations in Europe, everybody wants to hire a QP in-house. And I would always recommend that, we try and have the QP with the CMO at the earlier stage and bring it in-house later on. So that makes sure that we do transfer the knowledge in. And it's a step-by-step approach. So while it is quite difficult at the start, I think it's more difficult. I do think it's a scenario where it's continually something that you review and say, okay, we bring these activities in-house as we grow. The volumes grow, it's probably more cost effective to do it in-house, get the knowledge and the understanding more. And then you look at, do we bring the manufacturing internally then as well?
Mm-hmm. Very good. Very good. Did I hear someone wanting to jump in there? No?
Yeah, I can jump in real quick just on 2 points here. So to what Evelyn had said, the one word of caution that I would put out there is to resist the temptation to internalize everything and more so to, make sure that you stick to what you know. And that really goes along with the other saying when considering what you're going to be outsourcing is to know what you don't know, right? So that's one of the key parts. And to go back to what Todd was saying around data, your data is I think your most important asset that's coming out of a manufacturing campaign. And when we think about cycle times, when you're working with a CDMO, if you don't have a well fleshed out plan and you're not, again, going back to aligning on expectations from the beginning, getting that data out in the way that you want it is going to take you time. And time is money, time is precious, and everyone is, we're trying to go as fast as we can. So that's a really large consideration when you are outsourcing, to make sure that you have a plan there for how you're going to get your data and what that's going to look like. And then maybe I'll just add one other point, which is, with considerations to data, it's so important to start trying to embrace a digital type of architecture for how we're sharing our data, trying to get off of the traditional, just upload it to the SharePoint or have it in an email. If you can start working towards a digital type of architecture that gives you real-time monitoring, machine-based learning, better automation, all those sorts of things are going to give you a leg up in the advanced therapy space and really help you get, say, that IND enabling manufacturer out the door.
Okay, very good.
Yeah,
go ahead, Evelyn.
Yeah, just to add to that, Lewis, completely agree with Joe about avoid the temptation to internalize everything. And, when you're looking at picking a CDMO, particularly with the more downstream activities, they do, some of them offer a wide range of activities. And what I typically tend to advise is there's, 1 or 2 core competencies they tend to have. So, you'll have a distributor and they'll offer packaging, but their packaging service might necessarily be what you would need. It's, very just a very kind of localized approach to it for you to support you. And then you have packagers that offer distribution. And again, it's very, not necessarily what you need and the right distribution model. So similar to that as well, you have to look internally in your own organization, completely agree with Joe, and say, what are we really good at here? And we understand the science behind this. And that's where you can kind of look at and say, okay, here's what's more critical from a knowledge perspective and a success perspective for our product and our organization to retain in-house.